Welcome, everyone. Glad to have you today. Just wait a couple seconds for everybody to find their way into the room, and then we'll start.
So I know there's a lot of light behind me. I'm in my daughter's room, and don't tell her she's at college. So let me just go like this. Maybe that'll help. The window behind me.
That's all right. So my office, I get a lot of sunlight in the morning and big rays of light. It's nice. All right. So I think we mentioned this. This is late for some of our attendees because a lot of people come from East and Central time. So we expected a little bit of a smaller session today, but I think that's great. We can learn a lot and have some great conversations. So I'm going to start us off, and then if people come in, they can catch up. So here we are. This is the Health Equity in Action, Libraries, Communities, Opportunities Virtual Summit. It's hosted by the American Library Association's Social Responsibilities Roundtable, or SRRT. SRRT believes that libraries and librarians must center social responsibility by recognizing and helping solve social problems and inequities to work for the common good. My name is Rachel Rosekind. I will be moderating. I use she, her pronouns, and I am joined by my colleagues, April Shepard and Julie Winkelstein, who will be helping with today's session. Before we get started with presentations, just a few housekeeping items. To enable captions, click More in the bottom right of the screen, then click Show Captions. If you've joined us and have AI turned on, please turn it off. We will not be using AI for this session. If you need it for an accessibility issue, you are welcome to reach out to me privately in the chat, or email me separately, and I'll drop my email in the chat. We will be recording today's session. The recordings will be made available on our website and emailed to all registrants within the next few weeks, along with transcripts. This session focuses on how inequitable access to care in jails and prisons undermines community health. And we'll have kind of two different presentations, which are really more discussions. The first is Health Equity in Carceral Settings, a panel discussion on the professional and lived experiences with members of the formerly incarcerated People's Performance Project. The second is about medical neglect in carceral settings, breaking down the walls to healthcare access. The first presentation includes the following speakers. Mark McGoldrick, who will moderate the group, is a retired public defender and current co-director of the formerly incarcerated People's Performance Project, or FIP. FIP works with a troupe of formerly incarcerated people to bring stories from their lives to the stage in solo performance. Tylon Sizemore, Scott Schell, and Pamela Keane are all FIP performers. Scott Schell is the jail manager and post-release coordinator for Resolve to Stop the Violence program in the San Francisco County Jail. Tylon Sizemore works as an intensive case manager with the No Violence Alliance, also in the San Francisco Jail. And Pamela Keane performs with the Returned Citizens Theater Troupe and is a full-time student at Grand Canyon University, studying for her bachelor's in substance abuse counseling. Our second presentation will be moderated by Christine Mitchell, who's the program director of the Health Instead of Punishment program at Health in Partnership, a national public health nonprofit headquartered in Oakland, California. She's also an organizer with the Boston-based Deeper Than Water Coalition and co-author of the American Public Health Association Policy Statements on Law Enforcement Violence in Carceral Systems. She's joined by Wayland X. Coleman, founder and president of Coalition X Abolition and Incarcerated organizer with the Deeper Than Water Coalition, and Michael L. Mooney II, also known as Country, a graduate student at Boston College School of Social Work and a community activist and organizer. And we are very eager to hear your questions, which we will entertain after all of the discussions have concluded. You're welcome to use the Q&A to pose your questions, and you can use the chat to relay any tech issues or things of concern throughout the presentations. So with that, I will turn it over to Mark to please get us started. Thank you.
Hi, thank you so much for having us. A huge thanks, not only for having us here at this forum, but also for librarians and libraries. You guys are holding up the world right now. The free public libraries, the best thing America has going. So thank you for your work. I really, really mean that. So what is our work? We are the formerly incarcerated People's Performance Project. We have about 15 performers at any given time. We work with people who have been formerly incarcerated on the craft of presenting stories from their lives on stage. This is usually solo performance. So they're talking, acting out different characters from portions of their life. Some of them are earlier stories that led them toward their first carceral event, group home, juvenile hall, whatever bad events happened that led them toward incarceration. Some of the stories are inside carceral settings, prisons, jails, and then also the reality of coming out of these carceral settings post-release and the baggage, the trauma, the health events that maybe someone sustained inside jails and prison follow them out into the community. A couple ideas just generally that help me frame what it is when we talk about the health inequity of the carceral system. First and foremost, the correlation between poverty and incarceration. Most people, on a population scale, most people who end up in jails and prisons come from the poor echelons of society. Also, the overrepresentation of people of color in jails and prisons, way higher for especially African Americans, but then in California, also Latinos. And then the webbing of poverty and race when it comes to access to healthcare and poor medical outcomes. We're all familiar with some of these crazy statistics. We are all based in California, and that's where my experience as almost 30 years as being a public defender is. So I'm going to talk about California a lot, but it's really representative of what's going on across the United States. A huge factor in poor medical outcomes is overcrowding. We had in California in, for instance, 1980, the entire prison population in California was 24,000. By 1990, 10 years later, it was almost 100,000. It quadrupled. And then by 2000, it was 163,000. It topped out in 2006 at 173,000. So if you can imagine any kind of like system doubling and doubling and doubling, and the medical healthcare just never kept up with it. Whether it tried to, I don't know. But you're talking about double bunking, triple bunking, quadruple bunking people, putting more and more people in smaller and smaller areas with really poor medical facilities. With that goes rises in stress, in violence, in close quarter diseases, in medical neglect. Such that since 1995, there's been a federal overseer who had to take over the mental health care for California prison system. That receivership is still in existence, even though they've, in theory, made progress. And since 2006, a federal receivership has had to take over the medical care of CDCR, the California Department of Corrections and Rehabilitation. And that still is in existence. So some of these things help frame for me the setting we're talking about. Last thing I'll say before I pop it over to some of our performers. People who go into incarceral settings already are vulnerable from a health point of view. because they come from the communities that they already have things like environmental contaminants, environmental race problems that lead to them having higher rates of asthma, high blood pressure, more community violence. When they come into the system, it might have been through a violent event. They might have been assaulted by the police. So coming in, they're already medically vulnerable. Then they suffer whatever's occurring in the carceral setting, and then they go out the other end with greater mental and medical traumas. So those are just some ideas. And all of the three performers we have, Pamela, Scott, and Tylon, have all experienced some versions of this. Tylon, how about if we start with you? Tell us in a little bit about the health that you had when you went into prison and the kind of problems you had when you were there.
I'm sorry, say the first part again.
What do you think the state of your health was when you went into prison, and what happened to your health while you were in prison?
Well, my state of health was fine. I mean, I didn't have anything wrong at that time. It was unfortunate in California Department of Corrections, they make you eat very fast as if you have somewhere to rush off to. I never will understand that. As soon as you sit down, you don't have a lot of time to digest food and things like that. You're rushed. You're not able to bring food out, with you. And after about a year and a half, almost 2 years in my stay at Valley State Prison, my intestines erupted. And I didn't know at the time that they had erupted. I just was having a grave pain, and medical was called, and I was told to get up off my bunk and walk if my back wasn't broke by the MTA that is supposed to be sworn to care. Nurses are sworn to care. And she incited a riot, which all the ladies in the cell began to yell and bang on the doors. And because I couldn't talk, I didn't know my temperature was 105. I was starting to defecate. All my organs were shutting down. And it was very, very traumatizing to say the least, because I had a vegetarian mom back in the 70s. So I had never been to the hospital. I didn't know, I've never been sick like that before. It was very scary. And I'm not smiling or laughing about it. It's just one of those things when I think back, like, wow, the neglect of somebody my first time there. I wasn't a regular. It wasn't like she knew me. Nurse never seen me ever in my life. And so, I was rushed off by the officer. The CO was gracious enough because of my kind heart to save my life. He swooped me up and rushed me to the infirmary, and the infirmary had to call the warden to get the gate open to rush me out to Madera Community Hospital. So it was very challenging.
And just to take that further, this is one of Tylon's really powerful pieces, theatrically covers some of these events. And Tylon, when you were in the hospital, unlike, for instance, if I went to the hospital tomorrow, I would hope to have my family bedside and that kind of thing. For about a month, you were in the hospital with multiple surgeries and sepsis, handcuffed to the bed. And
yes, handcuffed.
The entire time, they hadn't contacted your family. Your family had to find out where you were. And even once your family found out where you were, they're not allowed to have any family at the hospital in your room. Helping, as we know, is so important when someone's in a hospital setting. And all that time when you were gravely ill, you're shackled to the bed.
Yep. That's exactly what it was. I mean, you kind of said it all. I didn't know what else to say after that. You said what happened. So I was like, yeah, that's what happened. Unfortunately, I had part of my intestine removed. I was given a few blood transfusions They said I left for a minute. I don't even remember the transportation to the hospital. Like I think I checked out for a hot minute. But yeah, my mother had to find out via the system because the ladies went to the infirmary the next day and I wasn't there. So it sparked a rumor that they did something to me. No one knew where I was at. No one came back to tell them, those that were concerned, hey, your bunky's okay. She's at the hospital. No one even came to tell them that. So they thought I was just, they dumped me somewhere or whatever, because there's been women that have died there and, nothing comes of it. So it became a big thing. And because the city is so small, people that know people got in touch with my mom, and she called the warden, and the rumor was she let him have it. Like, why you didn't call me about my, I'm grown, but still, I'm still her baby. So it was really unfortunate, that whole system, how that is set up for a first timer. Like, I wasn't even there for a life sentence. It was, I could see if I was doing life, like, just let me go then if that's the case. But I wasn't even I was almost, it was time for me to go home. And that happened. And it was very, very scary. I had to go through a lot of therapy. I can't have kids as a result of that. I had 31 staples. They took out my appendix. I just looked like Frankenstein. I have no more veins in my arms because of the intravenous food and medicine that had to kept, I couldn't eat. And so I didn't know that I just got out the hospital in January as a result of this same thing that happened. So I've been dealing with this medical issue for a long time now, since leaving prison, or being in there, I should say, and being neglected like that. It was really sad.
Right, right. Um, Well, in a little bit, we'll come back to like what it's been like with your health events post-release, because really think it's important for people to appreciate the fluidity of these poor outcomes. Like I said earlier, people go in vulnerable, it gets exacerbated in carceral settings, and then you leave with whatever the problem is, and you come out into modern America with not great health access for lower income people. Um, Pamela, when you were in an Illinois State prison, you have a story that you've done theatrically about one of your good friends in the pod, Juicy. Will you tell us something about what you personally experienced with Juicy?
Yeah, well, when it first started, Juicy, she was my neighbor, and she had me come to the door, and she said, she had this lump in her breast, and to feel it, and her breast was hard as a rock, and it just kept getting bigger and bigger, and she kept asking all us girls to feel it, and it was like, this isn't right. You need to go to the doctor here. And he was a terrible man, and she dropped slips, go see him just to have him turn her away, basically. It took about, I want to say, almost 2 years before they started chemotherapy on her. She had breast cancer. And by that time, it had gone so far that I had started working in the infirmary where she was, and they had proceeded to say that she could have surgery. And by the time she got the surgery, this was just 6 months, a 6-month time period. And by the time she got the surgery, just within the next 2 weeks, she was gone. They neglected her. They neglected the time that it took to get her the proper treatment. When it was obvious something was wrong, her breast had doubled in size of the other breast. And it was just it's a tragic story. And she had 5 kids. None of the kids got to come see her. They didn't give her what's that called, Mark, when they let you go home?
Like a compassionate leave or something?
Something like that, yeah.
Yeah.
They wouldn't approve it for her. They had put in for it. They wouldn't approve it for her, and they just let her die in the hospital. And her brother and his wife were the only people to come on the night that she passed away.
Right. And in the telling of it, you described how it might have been 2 years until they started chemotherapy for her, but it was a month or so before she could even get a mammogram, way after she, it was obvious, it was apparent. So just to get any diagnostic tests, let alone treatment for it, right? It was way delayed compared to what we consider to be a modern American norm.
Yeah, the doctor there didn't really bend over backwards to get things done for women there. It was, I mean, it was very challenging with him to get anything done, to ask
Right,
ibuprofen or anything. So yeah, he was very neglectful.
right. Now with Juicy, when she finally was diagnosed, she went over to um, an entire different wing of the section of the prison where you didn't know where she went anymore, correct?
Right. She had moved before that. She had
Okay,
moved pretty recently before that, before she'd even gotten a diagnostic evaluation. And then when it was almost 2 years later when I finally saw her again, and she was in the infirmary full time.
right. And just by happenstance, that's where you were assigned, so you kind of got reunited with her. And
Right.
at that time, in your show, you describe how things like couldn't get sheets, couldn't
Oh
get
yeah.
bedding.
Yeah, she
Um,
had asked me at one point to just please help her uh put clean sheets on her bed. And I went out to the nurses and I asked them, I said, excuse me, I'd just like to know, do you have any clean sheets? I was a porter on the infirmary infirmary
Infirmary.
and they told me they didn't have any. And I asked them, I said, well, could we go down to the laundry room and get some? And they said, oh no, we're not having any of that tonight. So I went back to her room and I said, here, Juicy, let's get you up. Let's get you some clean sheets on the bed. And I set her down in her wheelchair. And when I looked back at the bed, there was just this big brown silhouette on the bed of where she'd been lying for weeks.
Yeah.
And it was just a shame. I took the sheet off, shook it out, put some baby powder on it, turned it around, tried to make her as comfortable as I could. But the nurses just wouldn't help her with anything. She was embarrassed to ask me. At one point, she wanted to change into new clothes. They wouldn't help her do that. She couldn't really lift her arms because of the pain. And she had to ask me to put like a diaper in her panties because the nurses wouldn't even come around to help her get to the bathroom in time. So sometimes she didn't always make it in time. And there were another few incidents like her back hurt. She was in bed a lot. And she just asked for something so simple, the roll that goes under your legs to take the pressure off your back. And the nurses had it right under the desk. I could see it. And they told her, just roll up some blankets and put those under your legs. You'll be fine. They had the foam cushion. They weren't doing anything with it, but they were just so mean. They just
No.
didn't want to help the patients there.
Well, and I mean, another just kind of crazy portion of insanity and cruelty in that story you have is when you agreed to help Juicy have a shower.
Correct.
You had to do that on your own. The nurses were not helping her. And then when you were, and this was a person who was not that far away from their unfortunate death, when you were helping wash them because they couldn't reach their body, what happened when the CO came in?
Well, at first, I mean, just to let you know how dirty she was, when I started washing her, all you could see was brown pouring down into the drain. She was left filthy after her surgery. She had blood seeping through the staples, and they didn't even come to change a shirt that was soaked with blood. And so I took her down. I said, she wanted a shower. And I said, let's get you that shower. We took her down to the shower, set her down. And all of a sudden, a CO busts in. And it was a man, which was really odd because he shouldn't be in the female shower room. And he told me to stop giving her a shower and leave immediately, else he would give me a sexual ticket. And the sexual is a horrible ticket to have because you will go 30 days into seg where you're, locked down by yourself. And I told him no, I was going to finish giving her a shower, and I did. So he gave me the ticket, but the warden and IA and the CO sat on it for about a week. And then they decided not to give me the ticket. They just reprimanded me and said if I wanted to shower her again, the only thing I could do was sponge bath her
In the bed.
in the bed.
Yeah. So, they're not providing this person care. When you try to provide the person care, they write you up with a disciplinary infraction for having, the temerity to help someone, which is,
To help someone.
as if helping someone who's, on death's door shower is somehow a sexual activity. It's just beyond the degree of cruelty there is beyond the beyond.
Yeah.
And then, Pamela, while we're talking with you, you yourself had some problems, like with your hips and needing shoes. Tell us what it would happen when you would try to get your own healthcare needs met.
Well, I went to the doctor, and mind you, the doctor costs you $5 every time you go. And you have to drop 3 slips before you actually get to see him because they want you to say that you're sick enough to see him. And that's $15. Some porters only make $15 a month. That's their whole state pay. So they're trying to decide between personals or, a bag of coffee or just going to see the doctor, which is crazy. So I saw him and I wanted to just get some ibuprofen for my hips. And he asked me what was wrong with my hips. And I told him, I'd had a bone disease and as a result, I'd lost both my hips. And he just told me to pull my pants down and turn for him so he could see my scars. It was humiliating, but he wouldn't. I also asked him for shoes, if I could get shoes mailed in by my dad. And he said, no, only the diabetics could have shoes. I'd be fine in my prison boots that were harder on my hips. And there was a time when I'd asked him for ibuprofen for the hips, and he told me that all I was doing was drug searching. And I just told him ibuprofen's not a drug, it's an anti-inflammatory. He acted like I was asking him for some morphine or something. And so he wouldn't give me that. He told me buy it off a commissary. So he could either have given me a prescription for the Motrin, which I wouldn't have to pay for, but instead he wanted me to just go ahead and pay the prison for the ibuprofen. So
Yeah. Scott, now when you were in prison, Scott, a couple of things on these topics kind of jumped out for me with you. One is violence on the yard, and how traumatizing that can be to see or to be around or be threatened. And then also the radical racial segregation that somebody like you experienced, even if you didn't want to participate in it. You want to talk about either of those things?
Yeah, well, for the second point, about the racism, like as you know in my story, I talk about being mean mugged, right? Or some guy staring me down, right? Because I was talking to an African American, a gay African American guy next to me, right? And so I obviously want to know part of that. And that's not how I was raised. And I could see that it was very prevalent. And of course, the carceral system uses that, right? Divide and conquer, right? So they use that, of course, right? And fortunately, I never got challenged again, right? My Bucky had jumped up and told me, "Hey, you see that guy looking at you," that kind of thing, right? you can't be talking to him, right? And I mean, it was just like unbelievable. I was just like, oh my, I literally felt like I was sent back in time. It was like the 50s or something, right? So definitely the carceral systems use that to their advantage, right? Because they have everyone at each other, right? And so that's, a nightmare in itself. Um, and then when new people come in, you can easily be swayed and indoctrinated into that, obviously, right? Sometimes they don't have any choice, right? Fortunately, people, you know, I stayed to myself. I didn't get challenged again or tried to get like brought into some of that nonsense. Um, as far as and the violence, right? So part of my story, I ended up going from San Quentin to Susanville, and I was by myself walking the yard, and I see this guy by the counselor's trailer laying on the ground, and there was somebody looking at him. So he left, and I'm looking at him, and it was a Latin guy, and he was holding himself, shaking, almost like he was in convulsions. And I didn't see any blood, and there was a corrections officer like literally maybe 20 yards away from me, not even, probably 10 yards away from me, with his back to me. And I wanted to get help for him, right? But then my gut told me to, just keep going. And it was fortunate I did because they could have pinned it on me, right? Based on what people told me after. But he was stabbed 11 times, is what the word was, right? And so I don't even know what happened to the guy. You know what I mean? I don't know if he survived or what. And of course, I met many people, even folks in our FIP program that had experienced horrific violence done to them, right? And also partook in it, right? But so yeah, it's definitely a scary situation. I was fortunate that I wasn't there long. I did what's called a turnaround, so I basically finished my time in prison and they assign you a prison number and spit you out. So I was like, most of my carceral time was in the county jail. I did about a year in the county and like 5 months or something like that in prison, right? So I was very fortunate in that regard. But as somebody who I just want to speak really quickly to, well, there are a couple of things. One is there's been a great conversation going on between Julie and Tylon, right, about how these people are so miserable and mean, right? And I think that from what I've seen, I've worked in the jail now for 23 years. I've been going in since 2003. I've been doing this work for 25 years, but going inside for 23 years. And what one thing I see is that all staff, deputized staff, and other staff alike, they start out with good intentions, right? And then some, not all, but some, and some just want to be bullies. They were probably bullies in high school and they want to continue being bullies, but um, they get jaded and I don't know what it is. Maybe, I will say that one thing, it's a hard place to work in, right? It's certainly a hard place to work in. So that's a factor. And I think it takes a toll on people, right? But I don't, it's very bizarre, right? I know that, I fortunately wasn't ill. I did get exposed to tuberculosis and I had to take INH for 6 months and but fortunately I remember going to medical or dental like when I got to prison, they examine you. I mean, they're just in and out, right? It's just like kind of punching it's like check, 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 right? And the irony in it that a really messed up irony is that taxpayers foot the bill for jail medical, right? They foot the bill for everything. And it's a large amount of money, right? It's the most expensive, from what I've learned over the years, the largest cost in the carceral system is jail medical. And obviously, as Pamela and Tylon and Mark have stated, it's not healthcare, right? It's like, I mean, it's just not. I mean, if it weren't for those women yelling and hooting and hollering. And that one, who is it? That cornbread,
Stockton.
wait, that guy with Tylon, he took the initiative and picked up Tylon and saved her life. If it weren't for him, none of us would know Tylon, right? Or meet her, right? So that's just a fact. And what happened with Juicy is just unconscionable as well. I mean, it's just heart-wrenching. And I've seen I'm the jail program manager. And so, guys are sick. I'll check in with somebody. What's going on? Not going to class. Oh, I'm sick. Did you put in you put in a medical slip, actual request medical? Yeah, I put in 7, stuff like that. That's in the county jail, right? So it's really, really hard to see and not really be able to do anything about it, right? I mean, I have gone to people and said, hey, this guy, I run into people, and then there's a whole nother psychological aspect. I see Mark is trying to interrupt me, so go ahead,
Yeah.
interrupt me.
Well, I want to ask you about your program. Right now, you're working with people, and you're going to the jail to try to provide counseling care, right? You're trying there's
Well,
anti-violence and there's substance use disorder,
well,
right?
it's, I mean, yes, and well, I'm not a counselor, but what we do is it's cognitive behavioral change, right? It's about ch having people change their attitudes so they can change their behavior, right? It really goes hand in hand with recovery, right? From substance abuse, from those attitudes and behaviors, right? So it's really about basically we're trying to dismantle patriarchy is what it comes down to, right? So that's kind of the sense of it. But so we work with guys that have, DV, and we have a lot of people with attempted 187 and 187 in our pod, right? And I know some people would be like, well, why would you work with them? And I'm like, well, the hope is they don't kill somebody else, right? And they get out, and when they do get out, they live their life, right? And be a positive contributing member to society. And I'm seeing a lot more and more people are being released, right? That have done a lot of work while they've been incarcerated, right? And they get out like me, Tylon, Pamela, and give back, right?
Right.
Because we've been there, and and we see, basically it's like I mean, I know I'm speaking for Pamela and Tylon, but I feel I'm not out of pocket here. It's our passion, right? Like we care about people, right? We have that in our hearts, right? So
So, Scott, with your programming, one of the things that we've talked about in some of your newer material is on how you're trying to do this programming, the behavioral change work that will lead people to be less violent and have more tools to resist substance abuse disorder. And then the staff messes with y'all
yeah.
and like torpedoes the programming you're doing. Tell us about that.
Yeah, it seems like, I mean, it's always been an issue. I know when they originally started RCP and I was a participant, they started in 97. I was in there in 98, 99. You had a lot of support from the command staff, right, when they first, so there was a lot of support, and that went down, down the ranks, right? So, I mean, there were some deputies that could give a shit, and they're like, programs don't work, that whole mentality, and whatever, you're still an inmate. But so fast forward to now, and like coming out of the pandemic, a lot of we were shut down, right? Nobody went in. I was the first one to go back in, and that was like talk to people at their doors after 15 months. We didn't do classes until 2 years, right? A little over 2 years. So you have a bunch of deputies hired during the pandemic who don't even understand how to run a program pod. They don't understand how to run a pod, period, right? They're getting bullied by the guys in the pod. But so it's just been a nightmare. And of course, there's people that just want to sabotage us, right? Really. I mean, they really do. I mean, they'd rather sit. Why have programs happen when, or why let the guys out and have free time, which just speaks to the mental health. Why let them have free time when we can sit at the podium and shoot the shit about the game last night, right? I mean, that kind of stuff happens, right? And so,
You're
I
you're
wanted to
talking about
say
the
something.
you're talking about the deputies just hanging around,
yeah,
shucking and jiving, or like watching
yeah.
their phones or talking about basketball.
Yeah, I'll come in
It-
like in that piece I'm working. I'll come in. Hey, were you guys on lockdown? Yeah. You didn't get no free time? No, we got maybe an hour one day or whatever, right? And I'm like, was there only one deputy covering both sides, right? The way the pods are broken down is there's 8 pods, but there's 16. There's A side and B side. So sometimes due to staffing, they'll have one deputy covering both. And they'll be like, no, man, there were 3 of them there. And they were just like hanging out, right? Talking shop or whatever, right?
and what you find is um, sometimes either through indifference or animus or incompetence, they don't let you do your program. They
Yeah,
end it early, they start it late, um, or they just shut down a pod so that the guys kind of go stir crazy. And then
right.
you've described more violence because the
Exactly.
people aren't getting their out of cell time or their out of unit time, and they just get on each other's nerves. So when they mess with your programs and mess with pod time,
Right.
people aren't doing as well, and the violence goes up.
Exactly. We don't, so we haven't, still, it's 2026. We haven't acculturated our pod yet, our program yet. We're still struggling to get to build, establish that culture, right? Um, in the past, there were no fights in RSUP. None, zero, none. The first year there was like an almost fight. When I was there for like a year, there was an almost fight, right? It just didn't happen, right? Guys would sit down with people, do peer-to-peer interventions at the table and go, hey, what's going on with you guys? Man, you guys got to knock it off. Like, what's happening, right? So they would stop it before it even happened. But when you have us not being able to get that culture going, coupled with all the lockdown, 2023 was a nightmare, man. There was half the time we could have done classes that were locked down, right? So you're literally cooped up in a cell. You can't come out, right? You're with your cellie, and it's like, dude, what are you doing? You didn't flush the toilet again or whatever. Next thing you know, they're boxing in the cell, right? I mean, it doesn't take much, right? So, I mean, they're literally going stir crazy. They have no out of cell time, right? And just to get away, maybe one guy wants to stay in their cell and chill and be by himself, and the other guy wants to go walk around, whatever, right? So the mental health is real, and that needs to be spoken about more, right? And Tylon knows we've got some people in the
Yeah,
county jail
I'm trying to,
that have
yeah,
been
I
there for a
really want to
long
say
time.
something about that.
9 years, 8,
Yeah,
9, 10, 12 years.
I've been there 10 years. I've been working
Yeah.
in there 10 years, and I really wanted to say something about that because it's very personal. When clients are sick, I will go. I've had to call nurses at other jails that I know. I've had to befriend people to try to make allies to advocate for people that are sick, and this is just something that I know. I almost lost my life, and I don't take that lightly. And it's really horrific that the judgment is there. Like, just because that's the county jail, first off, those people aren't even convicted of a crime yet. So that judgment shouldn't even be in
Mm,
place. Like, everyone there is innocent until proven guilty, and yet they are treated as if, just the common, and it's just yeah, I've had to advocate very strongly for healthcare in there, especially for the guys, because they think that men can't have issues, and they do. And it's very challenging being in there 10 years, seeing what Scott talked about, the lockdowns, and that mental anguish of being in that cell with somebody and it's 100 degrees, and then you gotta go to group and talk about what? I wanna go get on, I wanna get in the shower and I wanna call my kid or my wife or whatever,
mhm.
So it's very challenging in 2026. 2020 was very hard. We lost half the deputy staff that were allies and people that were
Mm,
really willing to help us. And then now we just have a bunch of young people who are very disrespectful, and kind of just don't care. Like, I think that they just hired whoever they could to keep the numbers where they need to. I was told by a higher up that the jail can't operate if they don't have enough deputies. So if emergency breaks out, someone has to be here to man that station, someone has to be there, and then if someone has to get transported, they need to have X amount of deputies for people to be able to program. And I'm just like, yeah, Scott and I could run the jail by ourselves and we probably wouldn't have any problems. Like, it's just like, let hire people that have love in their heart. And I think, that's my solution, but I'll stop there. Yeah.
I actually
So,
had a deputy, really quickly, a deputy approach me. And because there was a gentleman I had to kick out of class, right? He wasn't responding to my intervention, so he had to go, right? And so the deputy addressed him, and then he came up to me later and he said, should I have been more stern with him, right? And I'm just like, but you can't make this stuff up, right? It's like, Look, man, I'm not a deputy. I'm not here to do your job. I'm here to share information with people so they can stop their violence and change their lives. Like, leave me the hell alone, right? Do you figure out what your job is? It's not my job to train you. However, it becomes that program staff are like training deputies how to do their job. It's ridiculous.
So, right now for these sessions, I think we're at time,
Yeah.
for our initial portion, the formerly incarcerated people's performance project. We're going to kick it over in just a second to Christine. The only thing I'd say is we're only skimming the surface here of this topic.
Yeah.
It's an enormous topic. We could keep going with these conversations on these different topics that we haven't even started for hours. So this is just a thin veneer on a huge topic. So we'll stand by for later questions and answers.
I just want to give a shout out to Michael. You're in my hometown state. I grew up in Massachusetts.
Michael in Boston? Are you in Massachusetts? You in Boston, Michael?
I thought I heard BC, right?
No,
Michael, are you in Boston?
Um,
See, this is that technology. See, we too old for this. Don't nobody know how to work this stuff.
okay.
it looks like he unmuted, but I'll just say I'm from Rhode Island. I
Oh,
spend a ton
okay.
of time in Massachusetts.
My first Grateful Dead show was in Rhode Island. Yeah, I grew up in Nantucket. Yeah,
Oh,
Nantucket. Yeah.
I remember that because I saw you at I saw you at Berkeley Rep, and I remember
Oh,
being in your
okay. Yeah.
Anyways,
Cool. Nice to
Mike,
see you.
you're frozen.
Yeah, he froze up. Oh, there he is.
maybe try to. Sometimes it helps to cut the video.
Hold on. I'm currently in Worcester, but
Oh,
I'll be
okay.
going to school. But I'll be going to school in Boston College.
Oh, cool. Right on. Been to Worcester too.
Yes, I live it.
Yep, spent a lot of time in Worcester.
I live in.
So that's not Dorchester. That's not Dorchester.
Yeah.
Hello.
All right. We'll kick it to you, Christine. Sorry, we got the New England thing.
Sounds good.
Yeah.
No worries. I'm just outside Boston too, and I have Wayland on the phone. He's in Massachusetts. So we got a Massachusetts crew here.
Yeah.
Okay, we'll get started. I do want to just note before I kind of dive into things that I have Wayland on the phone here. He's currently incarcerated in Massachusetts, which means the Massachusetts DOC is tuning in, given that didn't mean to thumbs up that. Given that all calls from inside are recorded, and two, that the calls are 20 minutes, so Wayland will need to kind of call in, and I'll answer the phone when that happens every 20 minutes.
He's not on the phone now, is he?
He's on the phone right now. Yep.
Yeah.
Yep.
Yes. Hello. I'm on the phone.
So yeah, I'm gonna get started, and then Wayland, pass it to you if you're still kind of in a phone space, and then Country, pass it to you.
About 11 minutes.
Yeah.
So would it be best if I just call back?
Hang on. I'll probably talk for just 10 minutes anyway. So yeah.
Okay.
Yeah. Okay. So I have a few slides just to kind of give us a visual here. Just the part of what we're hoping to talk about is, thank you, Tylon and Scott and Pamela, for sharing your stories and the stories of folks inside, and the horrible things that folks have experienced at the hands of the jail and prison system. And I'm sorry that you've experienced that, but I appreciate you sharing it and yeah, calling attention to it. So we'll talk a little bit about that also, just about medical neglect inside, but also want to get into kind of some of the organizing we've done to break down the walls to healthcare access inside. And especially since it's the American Library Association, want to talk about kind of the importance of what it is to break down those walls, build relationships, have access to things like books and resources like that. So we're kind of representing two different orgs here. I'm the program director for a Health Instead of Punishment program at a public health org called Health in Partnership. It's based in Oakland, California, but like I said, I'm just outside of Boston. And we work to transform the field of public health to center equity and build collective power with social justice movements. So we kind of work on a number of different issue areas. The area I work on is community safety, so the health impacts of things like policing and incarceration, immigration enforcement, surveillance, kind of that whole bucket of things. And then Wayland Country and I are all organizers with the Deeper Than Water Coalition, which formed in 2017. It's a coalition of currently and formerly incarcerated organizers, their loved ones, and abolitionist organizations in Massachusetts. And we've used the lens of environmental injustice to illustrate the human rights abuses that occur in prisons. So we started around toxic water in one of the prisons in Massachusetts, and then really kind of expanded beyond that, including medical neglect inside. So we've had some like really, powerful stories, and I know Country and Wayland have powerful stories to share as well. And so I just want to share a little bit of the kind of numbers. We've done surveys both in Massachusetts and in California prisons about medical neglect. Wayland wrote a survey that we've circulated. And so I just want to share just to get a sense of the scope and the scale of this. So these are results from the survey that we did in Massachusetts prisons. 79% of folks who responded inside said they had experienced some form of medical abuse or neglect while they were incarcerated. 80% said they had to wait a long time to receive treatment for something they were diagnosed with, or an injury that the prison staff knew about, but refused to kind of provide medical care. And nearly a fifth of folks who responded said that the Department of Correction in Massachusetts they forced folks to receive medical treatment that they didn't want. In California, we specifically worked with California Coalition for Women Prisoners, so folks who were incarcerated in women's prisons in California. And there we kind of specifically heard from folks inside the amount of reproductive abuse, coerced sterilization, or untreated reproductive health issues that folks were experiencing in women's prisons in California. 40% of respondents said they had experienced that. We also surveyed transgender and gender fluid and intersex folks. And gender affirming care is so rarely provided inside. And we know that there are harmful consequences of not receiving that kind of care for a trans person, things like depression and self-injury and suicide. Again, in California women's prisons, there's a big prevalence of sexual and gender-based violence inside. So 47% of folks who responded to the survey said they'd experienced that form of violence while they were incarcerated, either from guards or from other folks who were incarcerated. And then due to transphobia, transgender people experience even higher rates of violence in prisons and jails. In the survey that we did in California, 67% of the trans folks who responded said that they had experienced some form of discrimination or violence for being trans while incarcerated. This is a kind of small, it's a graph of the different environmental health and safety hazards. And this again goes back to the Massachusetts, the survey we did in Massachusetts. I won't read through all of these, but folks are experiencing things like polluted water at very high rates, unsanitary food services, mold, lack of food, rodents and pests, things like excessive heat and inadequate ventilation. And I know X and Country can talk more about that. And then the last thing I'll say, or I guess two things I want to say. One is the use of solitary confinement, and folks from FIP shared, about kind of the use of segregation as a way to punish people, and often as a way to punish people for having health needs. And so again, just some of the numbers on that. Black and Pink, which is an organization that specifically works with LGBTQ prisoners, they did a survey that found that 85% of people who were LGBTQ respondents to their survey had experienced solitary confinement. And I won't read this whole list, but there are a whole number of physical and mental health consequences of being in solitary confinement. Often we call it, and the UN calls it, torture. It really is to just be isolated in that way. And then the last thing I want to share is just that separation from families and communities can have huge impact. So in women's prisons, over 60% of people who are incarcerated are parents to children under 18. That can have long kind of intergenerational impacts on young people whose parents are incarcerated. And there are also like what we call spillover effects in public health. So impacts on the community. So communities that with high incarceration rates for people who are not incarcerated have higher rates of things like mortality, preterm birth, depression, and anxiety. And so that's for people who are not incarcerated, but are in communities that are highly incarcerated. So I'm gonna pause now. That was a lot of information, and I want to ground it again in people's stories and experiences. Wayland, I know you have to call back, so I might kick it to Country first, if that's okay, and wait for you to call back. Okay.
You have 1 minute left.
Country, I don't know, do you want to kind of intro yourself and some of your experience of healthcare inside, and if you want to talk about the campaign? I think like systemic change is an important part of this, the WellPath campaign that we did.
So I would like to thank everybody for having us on today. And so systemically, one of the biggest issues that I have with medical care to incarcerated persons is the fact that a lot of these companies are for-profit organizations that masquerade themselves as nonprofits. And I don't know if a lot of you know that these companies such as WellPath and Vital Core and all of these companies actually make money for not treating people for medical care. And that's one of the large reasons why incarcerated people face the obstacles that they face when they're incarcerated with getting the attention and medical care that they need. So a few years ago, a lot of our colleagues were concerned
I'm not
about
trying to interrupt,
the
but you
number
are breaking up really bad. You may
of
want to try taking your video off.
people that were um, contracting cancer that was linked to
Country, can you hear?
arsenic and large levels of manganese in the water at MCI Norfolk, and it seemed to have been concentrated out of one particular unit, Unit 4-2, where a lot of individuals that we know ended up and passing away. Like some of them were close to me, and some of them so let me know if that helps.
Yeah, leave
So
your camera off, Country. It's better
yeah, I
if
can hear.
leave your camera off. Okay, it's better if you're
Is it
if
still
you're,
breaking up?
we can hear you when your
Hello?
camera is off. Can you hear
Hello?
me?
Yes,
Can you hear me?
yes.
Wonder if he can't hear us now or something. Maybe.
So the camera's still off. I don't know.
Really.
Yeah. All right. So a lot of people contracted cancer that a lot of people were close to on the inside. Uh, Hello?
Yeah, we hear you. Keep going, Country.
I don't know what's going on with this. We challenged. But anyway, so a lot of people passed away from the water, high levels of manganese and high levels of arsenic and all type of things in the water at MCI Norfolk. And we just uncovered a lot of different issues that were going on with the medical care, especially with them turning people away and not treating people, and them actually making money off of neglect. So there's just a little small brief history, and I'll probably pass it back to Christine because of my technical difficulties having on this side.
It's much better with your camera off. We could hear you with your camera off. So leave it that way and you'll be good.
Yes.
Okay, cool. But I'm gonna pass it to Wayland for a minute. Wayland, do you want to intro yourself and share anything you want to share? But I know we talked about how you've approached kind of breaking down the walls inside and outside, building relationships, having access to different resources.
Yeah, absolutely. So can everybody hear me well?
Yes.
Yes.
Yep.
Awesome. So my name is Wayland Coleman. I'm incarcerated. I'm in MCI Norfolk right now in Massachusetts. I'm actually telling you from my cell. So I've been incarcerated for 28 years. I was 19 years old when I was incarcerated. I was sentenced to life without parole. When I was sentenced to life without parole, I realized that there was something wrong with that, right? I'm accused of a shooting case. I didn't commit the shooting. So I trusted the system thinking, no, well, they can't prove you did something. And I was absolutely wrong. And so I came into a rude awakening of just how, intentional this system was. I'm not going to say the system is damaged or flawed. It's intentional. So I've adopted abolition as my path. So I do all of my work with the goal of eventually abolishing the prison industrial complex by essentially building communities in our society in a way that not allow prisons to have a justification. So a lot of my critique about what happens with our medical abuse powers from prison staff, my critiques are designed to expose not flaws in the system. I don't believe the system is flawed. I'm trying to expose how intentional the system actually is. Listening to the information that was provided by the three previous speakers, Tylon and Scott, I was making a lot of notes, and one of the things that came to mind is that it's very unfortunate in the stories that you all told, not me, because those are the same stories we have. So, who can't get treated for cancer? Its story is well too similar to the stories that we have. When you see we're in two completely different states, but we have the same stories, we can actually, I would be willing to bet if you talked about this issue in Alabama, Texas, New York, Pennsylvania, right? We'll still have the same stories. So if we have such the same stories, then we can't say that there's some type of error in the way the system is working. We have to acknowledge that the reason our stories are the same and so consistent is because there's a strategic going on. And we have to figure out what this strategic thing is. Just as medical treatment is essentially standard out the state. So there's, I'll give you a story. Friend of mine, there was this article written about him. So this was an older person. He was, I believe, 3 years old when I met him. He was serving 15 years to life. He had just got incarcerated, so he had a long time to go. And he had diabetes. And before I met him, he was having an issue where they wouldn't clip his toenails and stuff like that. And so he started growing green his big toe. And because they wouldn't send him out to an outside hospital, he actually had to sit in a cell with a razor and cut his big toe off at the knuckle of it, right? He only received treatment because when he cut around all the flesh of his toe and he pulled all the, dead muscle and skin off, he has this bone sticking out. And so that's the only reason they sent him out for the surgery. But he had to cut off his own toe in order to preserve his foot because he would have ended up losing his whole foot. Unfortunately, he passed away last fall. But that's just a story of very egregious neglect from our medical system, where a person has to go to the end of cutting off their own toe. So these stories are just too similar. There was just a person who passed away. Norfolk's been under fire. Norfolk right now is under the microscope, having so many deaths in the prison. Like the death has risen this year alone in Norfolk. And the suicides have been going up. Suicides in the South Third Confinement Unit, etc. So all of these things are going up here at Norfolk. It's under investigation right now. Just about a week ago, 2 weeks ago or so, there was a person who needed medical attention, and people in his housing unit were telling the COs in the unit that he was in trouble. He needed help. Call medical. Call the nurse. Hold it up, right? And the COs wouldn't do it. So the COs were just saying, oh, he's all right. He's just high because of the K2 issue. Oh, he's just high. Just put him in his bunk. He'll be okay. So people start telling the COs, no, he's not okay. He needs medical attention. Unfortunately, the person passed away in his cell without ever receiving any attention from the COs. When the COs finally decided to check on him, he was already dead for at least 10 minutes. And so what they did was they tried to cover it up by they called the nurses over. The nurses came over and started giving them like an EpiPen. Right? They give us because of K2 overdoses. So they started giving them an EpiPen. One of the people told the nurse, "Why are you doing that? He's been dead for at least 10 minutes already. So why are you even doing that?" The CO tells them, "Well, if you mention that to anybody, that he was already dead before the nurses got there, we're going to give you a disciplinary report." Right? So they used this kind of disciplinary consequences to silence the person who was sitting there trying to get the person help. And this is, like I said, just about a week or two ago. And so this stuff is egregious. And so we can't, and so I'm not willing to say like, this is something that needs to be, right? Because I don't think it's something that's broken. This is something that doesn't need to exist now, right? So instead of trying to figure out how do we get a better medical practice in the prison, we have to figure out how to get people who are unfortunately incarcerated the same medical access that you have out there, right? We don't get access to hospitals because our medical providers, nurse practitioners, are the gatekeepers. When it was Pamela who was talking about the issue with Lucy not being able to go out for treatment. We experience that all the time because what happens is the medical providers act as our gatekeepers. If we have an issue, we have to put in a sick slip. It takes about 2 or 3 weeks for them to answer your sick slip. Then when they do answer your sick slip, you go to your nurse practitioner. Now, if you got a growth, you got pains in your stomach, you feel a lump, you do all this stuff. The nurse practitioner is going to try to convince you that there's nothing wrong with you, because the nurse practitioner don't want to send you out to a specialist or to any type of treatment. They do that to save money. Right? To send people out for MRIs, that costs money. CT scans you'll never get because that costs too much money. And so they try to keep everything in-house in order to save money. And so I just want to highlight those type of consistencies that exist across the board. Not just Massachusetts, that's not just California. That's consistent across the board. I'm going to transition for 1 second to the issue of mental health. Massachusetts has been having a lot of suicides. The way that they treat mental health is they ignore you and they punish you for it. I myself spent a little over a year in solitary confinement because I put in to see mental health specialists to help me understand and try to help myself with stress. Right? I was afraid that I was going to slip into depression. I was having issues with to live with a million different cellmates. They were swapping out my cellmates every 2 months. Intentionally, just to uproot me and keep me, unfocused. And so they would put me in with short-termers and stuff like that, who would be going home in 30 days and stuff like that. So I ended up with a bunch of cellies. And it was starting to stress me. So I put in for mental health so I can start understanding what depression was so that I can figure out how to get over whatever it was I was going through. I got written 46 disciplinary reports. Spent over a year in a hole trying to get mental health help. Right? Still never got the mental health help. Right? They ended up just sending me back to Norfolk. Right? And hoping that I stopped complaining. So, but it cost me that type of consequence just to say, hey, I'm stressed. Can I talk to somebody? Right? That cost me 46 reports in a year in solitary confinement. Now, in solitary confinement, Massachusetts has this practice where they claim and they don't recognize solitary confinement anymore. So now they're calling it the BAU, the Behavioral Assessment Unit. What they did was they took locking us in 23 hours a day, right? We would have 1 hour recreation period. So the UN determined, well, keeping a person, in solitary confinement for more than 14 days is torture. So Massachusetts said, well, we're not going to recognize solitary confinement anymore then. We're going to call it a BAU. And because solitary confinement is when you have a person in a cell for 22 hours or more, right, per day, that's solitary confinement. So Massachusetts said, okay, Well, we're going to still put them in a hold, but we're going to only lock them in for 21 hours a day. But we got 2 hours outdoor recreation that we can choose to have, and then we can spend 1 hour chained to a table. We want like indoor rec, right? You're chained to the table. So they did that in order to just lock us in for the 21 hours. Because we're only locked in for 21 hours, that gives them the excuse to say this is no longer solitary confinement. That's what they're doing here in Massachusetts. So we still refer to it as solitary confinement because nothing's changed since they've been in the hole. But then you have a little bit of extra recreation. I want to highlight that stuff. So, and not taking up too much time, I do want to mention the importance of building these relationships, like Christine mentioned earlier. When I first came upstate, I didn't want to trust the medical system with my health. So what I did was I bought medical books. I studied medical books in and out. Medicine for the practicing physician. You know, you're talking about the books they study in the hospitals, right? Those were the books I wanted. And so I started studying medicine because I didn't want to trust them with my health. The importance of building these relationships is when we know we're in trouble. I can read my books, I can find symptoms and try to determine what I might have going on. And then I put that into a sick slip and they don't want to treat it. It's through being able to call people like Christine saying, hey, I'm feeling this way, here are my symptoms, and they won't do anything about it. Christine then in turn reaches out to the Deepening Water team and they'll organize like call campaigns, right? Where you have, 50, 60, 70 people calling in every single day until they see you. That's very effective, right? And that's the one of the benefits of building these relationships because it adds pressure on the medical staff to actually pay attention to your medical complaint. It's only through that outside connection that you can get that type of support. And here, if you don't have friends and family that's willing to look out for you, people that's willing to advocate for you, show concern for you, do wellness checks on you, if you don't have that, then those are the ones that they end up letting die, and it's unfortunate that we have to go through that. So I don't and I can keep going on this subject, so I'm gonna see if there's anything Christine wants to add. But yeah, but I'm hoping that what you'll take away from what I'm saying is that everything we're experiencing in the medical system in the prison, yeah, it's terrible, but it's intentional. And because it's intentional, we have to figure out another solution, not something that makes it better, but just figure out something else because this isn't working. It's intentional.
Yeah. Thank you, Waylon. And I just want to reflect that people in the chat are saying things like how horrifying it sounds the same everywhere. And that's very telling. That shows how intentional and systematic it is. And so, yeah, that's, and advocacy is a real thing. Tylon says, I haven't gone to college, but I have my doctorate in advocacy. And that's so real. I feel like that's such a essential part of surviving inside. Country, if you can hear us still, and hopefully the technology works, stay off camera, but you were heavily involved in like education efforts inside. And so I wonder if you want to share anything to that question of like how breaking down barriers and kind of, having education.
You have 1 minute left.
Has been important or was important in changing things for you inside.
Yes. So education was everything for me inside because I had a part particular professor by the name of Dr. Gary Donato, who he taught politics, but he taught it from a different vantage point. He really taught his classes as history classes. So we went through a lot of different materials that actually showed a lot of the structural racism that was inherent in this country. And what a lot of the guys that were in those classes, we turned that angst into activism and ended up just linking with
Country, sorry, your technology is not working. Agree. Yeah, I think we're definitely missing out.
because what's
He didn't.
Yeah, country, I don't know if that's gonna work.
Well, we got the great line, turning angst into activism. That's just wonderful.
Yeah. Let's leave it space for Q&A. Because I think there's a lot of space for, yeah, definitely we have to do it again, and we'll get country on the phone, maybe instead of Zoom next time. Let's turn to Q&A, because I think there's a lot of conversation that we can have kind of between the two groups of us.
Christine, the other thing you could do is if country simply called you on your phone and you could hold your phone to the Zoom.
I have Wayland on the phone.
There you
yeah.
go.
Okay.
You're juggling.
Yeah, juggling.
Okay.
And can I just say thank you to him before his time runs out? It's I feel like that's a one of the soldiers that's still in the army. You know what I'm saying? Like I'm out here free, and then I'm hearing this, and he's in a whole nother state, which I have ties to as well. My family, Dorchester and Roxbury, and so I'm in Boston quite often, and it's heartbreaking to just hear that. Like, wow, you are in a whole. I'm talking about very far away, and the same. That's just telling, and so thank you for sharing.
Absolutely.
Yeah, thank you for sharing with us.
And Christine, if I got like a few seconds, I want to add something.
Go. Yep.
So there's two things, because we're talking about medical, right? And why we can't get access to medical. I just want to tell you one more quick story. And I talked to Keane over this, and I think we posted something about it. And when I was in Garner, there was a person who was having trouble. I don't know if he was having a heart attack or stroke or what, but he made it to the medical department. He made it down to medical. And he was saying, hey, something's wrong. I'm in trouble. I need help. And the prison guard turned him around, saying, you haven't put in a sick call slip. You got to go back to your cell. He turned him around. He made it, like making it to the hospital, and then the police turned you around. So he made it, and he couldn't get any first aid or emergency care. So the guard sent him back to the cell. they wrote him a disciplinary report for being out of place. When he went back to his cell, he died. Right. So and so I remember calling Christine, telling her about that. So what I wanted to add was we had a lot of issues with the COs controlling our access to meth. Right. Even now, if I was to try to go out to a nurse because I'm having heart pains or something, the COs would be the one determining if I could even get to the nurse. Right. So that's a huge issue when you have prison guards who only care about control, dominance, repression, stuff like that, and it's the prison guard who controls the access. That's always going to be one of the reasons we don't get access. That's one of the things I wanted to say. Another thing I want to add to the conversation is one of my greatest fears of being in prison, and I believe I've mentioned this to Christine as well, is if you get injured, like when Scott spoke about the person who was stabbed 11 times, right? One of my fears that I always tell people here, and I believe I told Christine, is you have to be able to survive whatever your injury or condition is for at least a half hour, 45 minutes before you get any first aid or medical treatment. So if I'm out in the yard and I get stabbed, I have to be able to survive that for about 45 minutes. I hope I don't bleed out because I'm not going to get no medical attention for about that period of time. So one of the other issues is that there's no urgency, right, when it comes to needing emergency care. There's just no sense of urgency whatsoever. A person has a heart attack, we're looking out the window, we see the nurses just slowly walking. If you ever see the nurses running, the guard is hurt, right? They run first. They'll walk, they take their time. It's usually too late by the time they get there. I just wanted to add those two things to the conversation.
Thanks, Waylon.
Definitely appreciate that.
Yeah, Waylon, on that last point, and thanks, this is Mark. Thank you for your presence and your participation. We have a number of FIP performers who they've centered stories around things like a friend in state prison here in California who getting chest pains and complains that they're having chest pains, and the ETAs or the MTAs, the medical staff, they like, well, I'll see you on Monday. And then over the weekend, the person has a heart attack, even though they've been saying,
Right.
I'm giving you warnings of cardiac trouble, and they kind of getting blown off. And, you know, what you say about no urgency, totally true. You know, everything from like when Pamela's talking about you have to put in 3 sick calls over a period of time where you only get seen by a nurse before you graduate to the 4th one seeing an MD. All that delay can be a problem. And we see it on the front end, just like in a custodial arrest, which is what I usually saw it as a public defender. People with a broken bone, the police sick a dog on somebody, get all bit up by a police dog, someone beaten down, someone shot in the leg or whatever. They'll cuff the person up and they'll lay on the ground for a long time before the police will even let the ambulance come into the area. And during that time, you know, if it's one of the peace officers or a good citizen who's injured, they'll be doing CPR. They'll be doing medical first aid, emergency medical first aid, trying to staunch the bleeding. If it's a criminal defendant, they'll let them bleed out. They'll kind of slow foot the emergency response at the front end. And I know that happens again in the once they're in a carceral setting, happens all the more. Kind of an indifference to people's quality of medical care, an indifference to people's pain and suffering. And we see that not even in the carceral setting, but just with people of color who go to the doctors. Has nothing to do with carceral. You could have insurance, you could be a dentist, you go to a hospital, and if you're African American, you're likely to have your pain devalued, right? Get less painkillers because of things like Tylon. You want to jump on here? Tylon, when you go to get medical care post-release with some of the problems you've had, you there, Tylon? Tossing it over to you. Anyways, getting accused of drug-seeking behavior, right? Way more likely that they say it's not a real thing. You're just looking for drug seeking. When in Tylon's stories, she'll be like, I passed 10 different drug dealers on the corners who are selling good dope to get here. I'm not looking for your like hopped up Tylenol that has a little bit of, codeine. I could have bought real stuff on the corner on my way here. I want help for my medical
Yeah.
problem. And, they're way more likely to devalue the pain and accuse someone of drug treatment and drug seeking behaviors.
Well, could I slide in real quick, Mark?
Go for it.
So, one thing that, I mean, as I said before, I've worked in the system for a while, and so I've seen, I mean, ultimately, I mean, this story kind of encapsulates it. There's a lieutenant who, I've known him since he was a senior deputy, and he was a good guy, and we worked in the same facility out of custody, and he was for people getting help and turning their lives around and all that. Now he's a lieutenant, and he walks around, he's just grumpy all the time. And one day he stopped me and we were talking and he said that, until you do something different, I just see an inmate, right? So that said it all to me, right? So people are not viewed as human beings, right? So dehumanizing is an understatement, right? So there's just not, and it's scary as what the brother spoke about with, you have corrections officers who are not medically trained other than like first aid or whatever that, making these decisions, right? I mean, that's crazy. I mean, it makes me, it's scary to think and really sad to think of all the people who have died because of that, right? I mean, I'm sure it's countless, right? It's countless, right? I mean, it's very sad. And so there needs to be an entire shift in the whole criminal injustice system across the board. It's completely clearly not working, right? And as somebody mentioned, I think it was country about money, right? It's all about the almighty dollar, right? To provide as little as possible and make the most profit as possible, right? And that, obviously, unfortunately, in this capitalistic society, that is what, that's what our country's founded on, right? It's all about making money, right? So human beings' lives not so important, right? For a lot of people. It's very sad. And it's completely just unacceptable, obviously.
Prison profiteering, that's right. Oh, I'm sorry, I'm on this chat is going down. Like I wish we are recording the chat.
Yeah, I've been seeing that, yeah, for sure.
Oh,
So Tylon, nice to
Yes.
see you back. So tell us about, I mean, you've had any number of health events post-release because you've been out for like 20 years, right?
Way longer than that. I've
Okay.
been off parole 22 years.
Okay. So since that time, you've had any number of complicating medical events that you would relate to the stuff that happened to you in custody, right?
Right.
Tell us,
So can I? Okay, go ahead.
well, let me just ask you this and then take it away. Some of that stuff has, I know, emotionally traumatized you and changes how you feel about even seeking care in the mainstream civilian healthcare system.
Knowing what I know now is just all the more reason why my mom became a vegetarian back in the 70s. It's one of those things when you grow up and it just makes sense. All the stuff your parents said that you tried to fight and you didn't want to listen and all of that, it just makes sense now because first, I want to share that I ended up in prison due to the inequity of not having the restoration money. I had to pay restoration, and I didn't have it. So I went to prison from a $18 an hour job back in 1998, married, church member, everything, verified everything. The judge in Solano County decided to sentence me to 2 years in a correctional facility over a $6,000 restitution, which at the time, to take care of an inmate in California back then was $50,000. So the math, not even mathing. So I just want to say that right there, that was very intentional. You took a woman who was working. Granted, I did the crime. I get that. I did the crime. However, I never touched another credit card since 1995 when I first got caught up. I learned my lesson. I went to jail. I said, this ain't for me. And I changed my life. Nope, they didn't care about that. So fast forward, here I am. I passed out in the courtroom because I can't believe it. I was told I was going home and I passed out in the courtroom. Like my knees literally buckled beneath me when I heard the judge sentence me and remanded me, to prison. So here I am, first time there, having to be stripped butt naked in front of God knows, I don't know none of these people. Just mirrors put under your private parts and told to cough and spread and, on this long list. It was just so like reading the slavery history books. It just seemed like the same thing. And no one wants to call it what it is. Like, let's call it what it is. It's just more diverse now. It ain't just a particular group of people. It's a little bit of everybody now. So the unfortunate thing was that when that happened to me, I didn't know that I couldn't have kids. I didn't know that till I came home. I didn't know a lot of things had happened with all those cuts and incisions and adhesions and scarring and all this stuff my stomach and my body went through. I suffered immensely. Even coming home, I wasn't told the pain I was going to have in my stomach as with the healing process. And then people want to label me an opioid user because I had to go through pain management because of the pain was so great. Like it was just, it just kept, it's just ongoing. And it's unfortunate. I don't want to dominate or, monopolize the whole conversation, but because I can talk about this all day long. And, when you try to fight the system, you never win. And I don't mean, I don't, I just have to call a spade a spade. My broke ass ain't never going to win if I didn't have the money or the backing. You know what I'm saying? Like, I'm not going to win. I can go up and fight. They're going to pull up my history. They're going to say, yeah, but she slid credit cards. And I'm going to be like, yeah, but did I kill somebody? Like, it's just, it's so challenging. And it takes this group of people and everyone across the world, we have to fight. Like it's a fight. It's a fight, but they'll justify their actions. Like they'll justify it. They'll say, hey, well, she shouldn't have went to prison. Well, and then the world feels like, oh, well, they need to, well, if you go to prison, yeah, that's what you get and that's what you deserve. And, and some people think jail is cool. They think we in there playing cards all day. and no, they make you work. I work for 8 cents an hour. I have blisters on my hands. I'm working in the kitchen, cooking for 4,500 people. I ain't no culinary chef. I didn't know nothing, so it's unfortunate. And I'm just always humbled and grateful to have these conversations because I survived and so many didn't. So I always admire to be the voice for the voiceless because it's just horrifying. And I just got out the hospital in January.
So can I speak to something you said? Because it's very important, whereas like the people, have this belief that, we're just sitting in here having a good old time. I think that's very important, right? Because one of the things that we have to figure out, and this is going back to building relationships, one of the things we have to figure out is how do we get society to give a damn, because we all know if you're in prison, we have this mentality where we sit here and we say, well, nobody cares about us, right? Nobody doesn't care. People don't care. They think we're getting what we deserve, right? And so that becomes kind of a problem to solve, right? I used to always say, well, people don't care about us and this and that. And then one day I asked myself, well, what if they just don't know? And so that's why I went on this mission to expose whatever I can in hopes that I can educate society to make sure they do know, and that when these types of things are happening to us, you know, if they don't step up,
You have 1 minute left.
if they don't step up to advocate for us, at least we're taking away the excuse. They don't know, right? So when it does come to people thinking, well, this person's in prison because they did something wrong in society, and therefore they're getting what they deserve, how do we counter that narrative, right? Because that's the important part. Because until we can do that, that's the thing that keeps us separate from society, right? So
They won't. I'm sorry. Did his phone? He hung up. Did it hang up already?
No, he's still here.
Oh yeah, they won't discuss history. I think we have to discuss history and call it what it is and rewrite history. Like I think this is very important because as a Black woman, I'm already, it's already, I could be driving, I could be in the store with a pocket full of money. I'm still gonna, you know what I'm saying? Like there's so many other layers to this. And it's and he's right. Like, how do we get people to change the narrative? I was gonna ask Christine, do they have services in Boston in the prison where he is? Do they have CBOs in there?
They do. MCI Norfolk, which is where Wayland is now, has the or had the most programs of, prisons in general, in Massachusetts. But even there, they've started to be cut off and defunded. He's calling back now, so he can speak to that. Yep.
Because I know San Quentin has changed their title from prison to rehabilitative, and I feel like that's where it always should have been. Like it should have always been, let me go apply. I went to the state senator's office about them not, because that's prison. Like if I tell you to go to work, Rachel, and you didn't apply for the job, let's call it what it is. Like, let me go apply. If I want to be a gardener, if I want to do horticulture, or if I want to cook, let me go work in the kitchen. Let the people that want to cook go in the kitchen and cook, and it's so, yeah, this is deep, and it just this sad. I would have never known what was going on in Boston had I not talked or heard this young man. That's just crazy.
Well, goodness. Go ahead, Wayland, please.
Wayland just said Massachusetts is good at hiding.
No, California. Well, no, I won't say we hiding. I wrote a paper in college back in the day, the collegiate. What was it called? I got an A- because I wasn't good with the punctuations, but it was college versus the prison industry. And in California, they built more prisons than they have collegiate buildings. And so, what does that say to you? Where do you think they're trying to put people? That says a lot right there.
Sorry.
So,
and I'll always say whenever they build a new prison, the intent is to fill it. So you have to ask, who are you trying to fill this with? It's usually Black and brown and poor people.
Fast, quick, and in a hurry.
absolutely.
Yeah.
It's unfortunate. Do they have programs in Boston? You're in Norfolk, Virginia?
Norfolk,
Oh.
Mass.
Oh, Norfolk, Mass. I forgot. There's two Norfolks. So are there programs there where you are?
There are, yeah.
And is it for everyone?
I mean, you have to be eligible. right? The way programs work, like me being a lifeguard, the programs that I don't have eligibility to do. I mean, I'm eligible for parole now because 2024 Massachusetts Supreme Court ruled that, you know, given a person who was 19, 20 years old at the time of the incident, a life without parole sentence was unconstitutional. And so I'm eligible for parole now. But throughout my incarceration, there's a lot of programs that, you know, I haven't been eligible for. And even today there are programs I'm not eligible for. So you have to be eligible.
And
Wow.
We have, yeah.
sorry, yeah, we are wrapping up, but Wayland,
Yeah.
I'm dropping the link to your parole campaign right now in the chat, so folks can see more about you and sign on to support you too.
Yeah, please support that campaign. I was parole last May 8th. I was denied and given a 3-year setback in spite of a lot of positive and productive work I've done in prison. I didn't do my time fighting, having people joining gangs. I didn't pick up any bad habits. I did my time studying, learning, educating people, educating myself, doing what I have to do. My parole decision is somewhat retribution, I believe, for a lot of my advocacy work. So please support that campaign.
Keep up the great work. It's you know, it's from within. Sometimes, yeah, we have a coworker. We have a couple coworkers did a lot of time, and it's I can only imagine. And I will definitely look into your campaign and however I can support. I ain't got no lot of money. I live in California, but I just can do something else. Just thought I'd throw that out there. But yeah,
Well,
thank you so much.
Yeah, I'm with that too. That's crazy. Like as we know, some of our peers in FIP, right? They did every program under the sun, right? So I mean, that's just it completely boggles my mind as to why you can't have access to programs. That makes no sense. But yeah, I bookmarked the campaign and I bookmarked Free Whalen. Free Whalen. I'm all for it. We're gonna get you out, man. It's time. It's time.
So on behalf of FIP, because I know that we're just about at time here, we have performances all throughout the Bay Area, and check us out at fippp.org. All the time. We have several this week in different parts of the East Bay or San Francisco. Also, we have a 9-part podcast you can stream off of our website, and it's by it's live performances that have been recorded, and we've arranged them by topic, like healthcare events or racism in the carceral setting, women in prison, all these different topics. So thank you for having us, and check us out more if you're in the Bay Area or remotely.
Yeah. Wow. Well, thank you. This has been just so powerful, and feel so grateful that you all came and shared your stories. And I have some ideas about some other venues that maybe we could feature them. And I appreciate the parole campaign. I help coordinate it's called the Prison Library Support Network. We receive letters from people incarcerated across the country who have very little access to information in libraries. Oftentimes they ask about medical information, medical and health information. We have hundreds of people across the country, and we have a newsletter. So I'm going to share this link in that newsletter. And just really want to thank everyone. Thank you to our attendees, people who came and were here to listen, and really powerful. And I appreciate all your work and your advocacy.
Thank you for letting us share our truth.
Trusting us to listen to it.
Yeah, this was awesome. We should try to do this in person, huh? Like, where would we meet?
Yeah. Well, I work with our county libraries, so that's what I was thinking about, an on-site event at a county library here. Yeah.
Betcha. We're game. We're game, and come out to the theater. We go to you guys. And one of our mottos is changing the world one story at a time. We want to uplift these voices that people too often ignore. As is, for hundreds of years, we dispose of people of color and poor people, and prison. It's not an answer. It's inhumane. It's expensive. It's a waste of amazing, talented people. So we're with y'all. Peace out to Massachusetts.
Yeah.
Thank you, Michael. I got your message. Michael said, check out California Lawyers for the Arts. I'm
Yes.
sorry we couldn't hear you.
They're great.
Yeah,
California
I'm
Lawyers for the
trying-
Arts. Yes. Yes.
Yeah, I'm trying to get all these notes down.
Well, if you missed anything, email us, okay? And we can share anything that y'all missed, okay? We'll catch up and we'll have notes on our website too. So
Definitely appreciate that. Yeah, for sure.
And if you're ever in California and you want to stop by our offices at Community Work, Scott and I are co-workers. We'd love to have you. We could do circles here. We could do some restorative work. We have a restorative hub in San Francisco as well. And we have an office in Oakland.
you were Rocky.
Yes,
Rocky
we know.
I know Rocky. Yeah, I worked with him on a
Yes.
guaranteed income program. Yeah.
Oh, right on. Yeah, I got a couple of clients in that. So yeah, that's so we're not far, and I think connections are good and community is important. So please feel free to reach out.
Sounds great. Thank you.
Thank you, Mark. Thank you, Christine. And you guys are awesome.
Yeah.
Pam, Mike.
Appreciate
Okay, like Rumble Room. I see Christine.
Yeah, thank you,
Y'all
everybody.
telling y'all
Thanks for
age.
having us.